PPE is equipment that will protect the user against health or safety risk at work. It can include items such as safety helmets, gloves, eye protection, high visibility clothing, safety, footwear, and safety harnesses. It also includes respiratory protective equipment. There are so many potential hazards at a construction site, and personal protective equipment is one of the workers' primary lines of defense. Each item is designed to minimize exposure to certain risk of injury or illness, as well as the damage caused by those hazards in the event of a mission. Every individual construction site and job duty should be evaluated for specific and unique dangers and appropriate personal protective equipment required. Some common classes of hazard at construction site with risks that can be mitigated with appropriated PPE include electrical, fall, chemical, harmful dust, struck by, penetration, caught in and caught between, rollover, and heat. It's important that workers use PPE that is properly fitted. Each piece should stay on securely without causing discomfort or limited mobility. Clothing and other items should not be loose, as this creates dangers for tripping, getting caught in moving parts, etc. Inspections can be carried out by simply walking around your premises to put right any issues there and then. You may record your findings in a notebook or use a checklist to remind you what to look for. The inspection might include looking for unsafe condition and unsafe acts. Purpose of a health and safety inspection is to assess the safety of current activities in your workplace. Look for opportunities to improve on your current OHS systems. Identify immediate or potential hazards. Provide feedback on good safety practices. Respond immediately to any unsafe situation or activity. A safety inspection is a documented or formalized procedure that is often carried out by a safety specialist to identify potential hazards. Most safety inspections involve a checklist which helps inspectors thoroughly assess each area or potential hazard and pinpoint specific instances that may cause safety issues. First aid is the emergency care and treatment of a sick or injured person before professional medical services are obtained. It will only consist of providing temporary support until professional medical assistance is available. The purposes of first aid are to save life, prevent further injury, and to minimize or prevent infection. If you happen to be alone with the victim, reach out for your phone instead and make the necessary calls yourself. It's important that you never leave the victim alone. Things to keep in mind while making emergency calls. Give your phone number to the medical response team. Provide a concise but relevant description of what happened. Describe the current status of the patient and give your exact location. Bleeding wounds. Wear a pair of gloves before handling a bleeding victim. Encourage the patient to sit properly and relax. Check the wound for any foreign material. Do not remove any objects from the wound, as this may cause further and probably even more severe bleeding. While waiting for help to arrive, you can try to minimize bleeding by applying firm, direct pressure to the dressing on the wound. Keep the affected area elevated and restrained. Severe bleeding can cause shock, so make sure to call an ambulance immediately. Falls. If the victim fell from height that is more than 1 meter, that can already be considered critical. There is a high chance he or she could incur a head or spinal injury. Be alert and take note of the following immediate course of action. Call an ambulance straight away. Stabilize the victim and treat any possible concussion. Assess the victim thoroughly. Check for the following signs of concussion that need immediate medical attention, such as confusion, vision impairment, nausea, or drowsiness. If the victim has sustained any fracture, treat any incurred wound and immobilize the fractured area.